Hello, I'm Dr. Ravindra, and today I'm going to talk about oral health and hygiene. So, your smile is important, first of all, and I'm here to help you to keep it healthy and beautiful. How? I'm going to explain in a brief and in a short story, okay? So, first of all, oral health and oral hygiene. What is this? So, oral health and oral hygiene. Oral health is more than just giving a nice smile. It's about maintaining health and you know the healthy teeth and gums, which can impact your overall health. Okay, so that's why you should keep your oral cavity very healthy, following regular visit to a dentist at least 6 months once. Check your teeth, have a screening done. So if anything has to be done, the doctor definitely will advise whether maybe scaling needed or any fillings or something like that. Okay, which you don't know. So the next is the importance of oral health and oral hygiene. Okay, so a good oral health can prevent problems like cavities, gum diseases, and even oral cancer in case of drug abuses like tobacco, chewing. It is essential for your well-being, to have a good oral health checkup regularly. So the next thing is cavities. Cavities means uh, you know common language, tooth decay. Tooth decay. Okay, tooth decay means what? Cavities. There is a bacterial degradation of tooth structure. Okay, so bacterial degradation of tooth structure is called cavities. So some people, when we pronounce cavities when they visit us, so even though educated people, sometimes they ask what is this cavities? What are these cavities? So cavities means tooth decay. Tooth decay, how it happens? Because of bacterial degradation of tooth structure. So it happens when plaque buildups on your teeth. So plaque is a thin bacterial smear which occurs on a tooth surface every 30 seconds once. So every microfilms will be forming on a tooth surface. So which invites bacteria actually, which invites bacteria. So that bacterial stay on the tooth surface. So what bacteria will do? They release toxins as a waste products. So those toxins will lead to tooth decay. Okay, regular brushing and flossing can help prevent cavities. So that everybody should follow. So the next thing is gum diseases. Gum disease means it's a common language. Gum disease. Gum disease means according to dentistry, it's a periodontal diseases. So which related to your gums, gum tissue. So this gum tissue when it is diseased, that means any periodontal disease present in the mouth, it is something like a serious condition, that can lead to tooth loss. That means indirectly this will eat up your soft tissue, the oral mucosa, as well as underneath that we have a bone, a healthy bone, even that will be resolved because of bacterial action. So because of bone loss and soft tissue reduction, so these are called recessions, recession of soft tissue and hard tissue in oral cavity, that leads to mobility of your teeth. So mobility of your teeth means that tooth will start shaking. So that means there finally there will be a tooth loss. The tooth will fall. Okay. So that's why to check this out, you need a periodical dental visits, whether to check whether your gums are healthy or not. Okay. So it is very important to keep your gums healthy for any cause. Okay. Then the one more point where I'll discuss about the oral cancer. So oral cancer is a potentially life-threatening condition. Okay, so regular checkups, or as I told you earlier, the regular checkups should be there. Otherwise, so how this oral cancer happens? Because of tobacco abuse, smoking, then alcohol consumption, then all these so many types of tobaccos people chew throughout the day. So this will lead to atrophy of tissues in oral cavity. That atrophy of tissue will lead to, in long run, so complete change in the nature of soft tissues will lead to oral cancer. Sometimes you develop mucosal lesions, or mucosa means the lining tissue in your oral cavity. That also will lead to leukoplakia, like red patches, white patches, or oral submucous fibrosis, wherein the people will keep these tobaccos chewing in cheek side for a long time and enjoy it. So that will lead to oral submucous fibrosis. Fibrosis means the soft, tender tissue will become like a doormat, literally. So you can feel it will be a very rough tissue, and that will limit your oral cavity opening, a mouth opening. So that is called oral submucous fibrosis. That